please let us know. Bring them to our attention so we can get that lined up for you. With that said, I wanted to present Daniel Patterson, PhD, MPH, and he's with the University of Pittsburgh, and he's going to do today's webinar, and it's called Evidence-Based Guidelines for Fatigue Mitigation in Emergency Medical Services. Daniel, are you there?
I am here.
Okay, wonderful. Thank you. Take it.
Okay, thank you so much. And Christy, can you go ahead and switch over to my screen?
I handed you the presenter role, so you are able to upload your presentation.
Okay, do you see my screen?
I do not.
Okay.
You might have to share it.
Okay, I'm in the process now. Just stand by.
Okay. Oh, good. Now I see it.
See it? Okay, perfect. Okay.
And okay, there you go.
We're good?
Good.
Okay. Well, thank you, everybody, for attending today's webinar. Again, my name is Daniel Patterson. I'm an associate professor at the University of Pittsburgh, and I'm also a paramedic, part-time. And I'd like to share with you some of the results of a recent effort funded by the National Highway Traffic Safety Administration in partnership with the National Association of State EMS Officials. No disclosures. I'm not trying to make any money or anything like that. I am funded by a couple contracts and grants, and my main employment is at the University of Pittsburgh. Quick outline. I want to share with you a quick, brief background about emergency medical services in case many of you on the call are not as familiar with EMS as others are. Some background about sleep and fatigue in EMS and sort of generating the reasoning behind the creation of the evidence-based guidelines, and then segue into the guidelines themselves.
When I clicked on,
so
I had them.
I'm getting a little bit of feedback. So if some of you could try to mute a little bit, I think I'm getting a little bit of feedback. I apologize if that's causing an echo. But for many of you who don't know, there are approximately 20,000 or so EMS organizations out there, more than 800,000 paramedics, EMTs, and other clinicians who respond to and take care of approximately 30 million patients a year. They are deployed most often in teams of 2, but there are teams that are configured with 3 or more in certain types of systems. Safety is a huge issue in emergency medical services given the rapid response, the acute nature of the target population here being the acutely ill and injured. Motor vehicle accidents have been a problem in the past and are always going to be a threat. And fatigue, in particular, is a factor that has risen in recent years as a particular threat of interest. The problem of fatigue and sleep is, in some cases, best illustrated by bullet points on PowerPoint slides, but I like to more recently highlight some of the media attention that this issue has received to really emphasize the importance and significance of fatigue in EMS. So let me play this for you, and hopefully everyone will be able to hear it just fine.
In Maine, 2 ambulance drivers nodded off while driving. The first one was Wednesday in Bucyrus. The ambulance rolled over and took out a utility pole. The second in Bodenham. The ambulance driver fell asleep at the wheel early this morning, smashing into a guardrail. A nurse riding in the back was hurt. It's an industry where sleep is hard to come by. Palmer says depending on the day, she gets some rest.
We've learned that the ambulance was just feet away from its destination to Kaiser Permanente when that EMT says he fell asleep at the wheel, missed this curve here, jumped it, hit that sign, and flipped over. The patient was originally on the way to the hospital for dialysis treatment, but police tell me, fortunately, he was completely strapped into his gurney, so he was stable when that ambulance did flip over. The medic, however, in the back was hurt. He has minor to moderate injuries, including a big cut to his head. He was bleeding here at the scene.
The crash happened at about 5:40 Tuesday evening along this stretch of Route 5. The final minutes of the nearly 1-hour trip to the Chautauqua Nursing and Rehabilitation Center off Temple Road. The driver, a 49-year-old from Erie, Pennsylvania, told New York State Police she fell asleep behind the wheel.
It could have been so much worse.
They found that a second camera recorded what was going on inside the cab. Watch as the driver falls asleep at the wheel, only to be startled awake when he veers off the road and hits a sports car.
What we came to find out is that this driver is on the 24th hour of a 24-hour shift straight, without any breaks.
The Puckett ambulance driver involved in last week's fatal accident turned herself into authorities at the Floyd County Jail. 21-year-old Kristen Keys is charged with vehicular homicide in the second degree and failure to maintain a lane.
Now, the accident killed 55-year-old Tony Patterson. Police say that she fell asleep at the wheel before crashing into two trees and flipping over. Steve Jefferson explains why police believe the ambulance driver.
Now, those are just a couple news media highlights of some fatigue-related problems and sleep-related problems in EMS, and there are others, but I highlight those in today's presentation just to kind of give you a sense of the challenges of that sleep and fatigue pose in emergency medical services. Now, some of the data that we have generated from prior research show that approximately half of EMS personnel obtain about 6 hours or less sleep per night. More than half report their sleep quality as poor. And if you look at this graphic here, this shows that sleep is really variable depending on the shift. So the top one there is actigraph data from someone who works a 24-hour shift, and there's no red markings on that graphic, which illustrates that they were awake for the entire 24-hour shift. The middle one shows some red shading, which are sleep periods. And this person who worked a 24-hour shift was able to obtain some sleep during duty given the low call volume. The graphic on the bottom is another actigraph slip that shows that someone who worked an 8-hour overnight shift was able to obtain sleep immediately prior to the shift and a short nap during the shift. So while we have data that shows that sleep, approximately half of EMS personnel obtain 6 or less hours of sleep in a 24-hour period, you can see from these illustrations that it really is variable per person and per shift. Here's another quick illustration of, video clip of sleep in EMS.
I'd say absolutely my job has an impact on my sleep, both positively and negatively. Sometimes, depending on what's going on during the day, I can sneak a little rest in that I might not have otherwise, but at other times I am just going without a break.
I absolutely do feel that our job has an impact on our sleep, both at the workplace and in your personal life. Working in the EMS industry, you can get called out at any time of the night, so the quality of sleep that you're getting is not the best quality that you would at home, sleeping uninterrupted. I would say usually 6 hours of sleep.
I'd say I need at least 5 to 6 hours in order to feel pretty good.
Sometimes 6 hours is enough, and sometimes I can probably sleep for 10 hours, get back up, and feel like I need a nap 2 hours.
On average, about 4 hours of sleep, 4 to 6 hours of sleep.
I need approximately 4 to 5 hours of sleep to feel good.
I need 6 to 7 hours a night to feel good.
Anywhere between 5 and 8.
I'd estimate I would probably need about 6 hours of sleep to feel good on a regular day.
I need about 5 to 6 hours of sleep to feel good.
I feel good after about 4 hours of good solid sleep.
So you can see from these videos that sleep is really hard to come by for some of these EMS personnel, and that many of them obtain less than what is often recommended by the National Sleep Foundation and other organizations in terms of 7 to 9 hours of sleep per night. On this slide, you can see that the percentages of individuals who report feeling fatigue really varies per study, and then the graphic on the right are some bars that represent data that we've been able to gather from survey studies of EMS personnel over the years. And together, collectively, we estimate that approximately half or slightly more than half of EMS personnel report feeling fatigued while at work. And then this is my last clip here of individuals talking about how fatigue is a problem for them on duty.
I believe that fatigue is a big problem, and not only EMS, but public safety personnel in general.
I do believe.
I absolutely believe that fatigue is a problem with EMS and clinicians, and it needs to be fixed.
So you can see that a lot of personnel in EMS, emergency medical services, do feel strongly that fatigue is a problem. So all of this information has been gathered by representatives of EMS who have seats on the National EMS Advisory Council. And in 2013, that advisory council, comprised of EMS representatives and representatives of the public, issued an advisory that recommended NHTSA, DOT, and other federal partners try to gather the best available evidence out there to synthesize that evidence and distribute it to the EMS community so that they can begin to address the fatigue issue in emergency medical services. NHTSA in 2015 funded a project in partnership between the National Association of EMS Officials and the University of Pittsburgh, which I'm the one to lead on that, to gather that information, to synthesize it, and then to produce some evidence-based guidelines. And in 2018, we published those guidelines. And so what I plan to present in the next few slides is the result of that effort. The project has a website. If you go to emsfatigue.org, you can find numerous documents and the results of the guideline effort, as well as numerous presentations and other resources that may be helpful to you in terms of public safety and fatigue risk management. So quickly, what are evidence-based guidelines? These are essentially systematically developed statements that really help to inform those in charge of making decisions. These are statements informed by a collation of or synthesis of the best available evidence published to date over a given time period, say the past 10, 20, or 30 years. And again, they are really designed to help individuals who are in charge of making decisions to make the best available decision, the best decision they can make based on the best available evidence. There are numerous different ways to synthesize that evidence. This graphic on this slide just illustrates for you the technique that we used, which is an emerging standard in terms of scientific synthesis of the available evidence. It is referred to as grading of the recommendations, assessment, development, and evaluation methodology, in short, called the GRADE methodology. And I'll just walk you through it real fast. The top of that graphic shows PICO, which stands for the Population Intervention Comparison Outcome. That's what our questions are framed in. We then go through a process of gathering the literature, evaluating the quality of that literature, taking that synthesis to a panel, which is represented on the bottom part of that graphic, a panel of experts, and then tell the panel and inform the panel, here is the best available evidence for each question that you asked us to go investigate. That panel then is charged with evaluating the quality of that evidence, as well as discussing the balance and benefits of harms associated with a particular intervention that the evidence may inform. Also considering the values and preferences of the target population, and also any cost. And once they deliberate all those issues, they then come up with a recommendation that will then inform or comprise an evidence-based guideline. This illustration just kind of gives you a sense of what steps are involved in systematic reviews. It begins with searching multiple databases, evaluating that literature, and then summarizing it for those who are in charge or charged with making decisions. Our panel of experts was comprised of numerous individuals with expertise in sleep medicine and fatigue, and also emergency medical services, and as recommended by the Institute of Medicine, now the National Academies, includes representatives of the public. Our research team was comprised of more than 24 co-investigators and staff, as you can see here. Numerous individuals were involved in this effort because it does take quite a bit of manpower, person power, if you will, to pull off an evidence-based guideline project. The results. So we reviewed nearly 40,000 pieces of literature for 7 different systematic reviews that were related to 7 different research questions. As you can see in the far right column, the ultimate data, which is the evidence related most specifically to each research question, is often very small because the questions are very specific. Here are the recommendations that resulted from that effort. The first recommendation is that we recommend that EMS administrators and medical directors should use reliable and valid survey tools when trying to assess fatigue and sleepiness in their organization. That seems kind of intuitive, but what we don't want individuals to do is to simply make up a survey or to grab something off the shelf that may not have been validated or may not have been shown to be reliable. The second recommendation deals with shift duration, and it imposes or actually recommends that personnel work shifts less than 24 hours in duration. The third recommendation is focused on fatigue countermeasures, in particular caffeine, and it promotes having EMS personnel access to caffeine, not that they use it, but that they have access to caffeine as a fatigue countermeasure. The fourth recommendation is that personnel have the permission and opportunity to nap while on duty, in particular during long duration shifts and shifts that take place on overnight hours. And the last recommendation from this effort deals with education and training, that EMS personnel should receive education and training in sleep health and fatigue. Just a quick note about each of those recommendations. The recommendation for monitoring sleepiness and fatigue also has an accompanying performance goal, hopefully to help the administrators with operationalizing the recommendation into actual steps, meaning that we would like for the administrators to try to assess fatigue and sleepiness pretty regularly, at least once every quarter. There are numerous tools out there that they can use, and in the documents that we produced, there in the appendices, there are copies of these, or of many of these tools that they could use. In terms of shift duration, the performance goal set by the expert panel is that they try at their absolute best to have 100% of all shifts to be less than 24 hours in duration, but we know that the reality is in certain rural and very remote and frontier type organizations where call volume is very, very low and the funding for personnel is very limited, that some organizations in certain situations will need to have staff there for longer than 24 hours. But if at all possible, 100% of shifts less than 24 hours. In terms of access to caffeine, we'd like to have 100% of all shifts that have access to caffeine. This may seem intuitive, but in certain types of operations, it is not very feasible. And there is also a cost associated with that. And so we do acknowledge that. The expert panel did acknowledge that it is quite difficult in certain situations to provide access, but where possible, to provide that access to fatigue countermeasures like caffeine. In terms of napping, again, we'd like for, the expert panel would like for the EMS administrators who staff their crews or deploy their crews on long duration shifts, in particular those 12 or longer hours, and in particular those on overnight hours, to give them the permission and opportunity to nap. And in terms of education, we'd like to have, or the panel would like to have 100% of all personnel, especially new hires, to have education and training in sleep health and fatigue, and then to repeat that every couple years. What to focus on in terms of education and training, that's usually the question that follows. We are actually working on a number of fatigue education modules that address numerous different aspects of sleep health and fatigue, and we hope to test that in an experimental study here shortly in the next couple of years. We have also produced a guidebook that might be viewed as sort of a Cliff Note version of all the recommendations that was produced to really help the administrators develop their own model policies and procedures and standard operating procedures with respect to each of those recommendations. This guidebook is available on the emsfatigue.org website, free download. And I would invite you to go look at that. It might be helpful for you if you have questions about how do you proceed with developing a policy or a specific procedure or standard operating procedure germane to each of the recommendations. We have templates in this guidebook that might be helpful. Where to find all this information? Again, there are numerous publications out there. You can go to the emsfatigue.org website. There it is again on the slide here. The guidelines were published in March of 2018, so they've been out for at least a year now. I'm available for any questions if you have any questions related to the presentation. And we also, before I end there, I'd like to thank the National Highway Traffic Safety Administration and also our partners with the National Association of State EMS Officials.
Dr. Patterson, thank you. I do have a question. If anyone else has a question, I'll start it off. My question is this, and thank you again, this is Maria Mitchell for a very informative presentation. My question is this, very often when we have shifts in public sector where it's 24-hour shifts, the employees work 2-3 days a week and have, or 1 week on, 1 week off, different things like that. And so they have a good bit amount of time off. And I've seen that they tend to take a second job. And the fatigue, I guess my question is this, that very often the fatigue that they're experiencing is compounded by the fact that they may be on their off time, instead of resting, they're actually, performing their second job. I found that very often not only causes fatigue in the sense of drowsiness, but makes them more prone to injuries, to muscular injuries and other types of injuries, because their body's tired and isn't really regaining the rest that it needs to before going on another physically demanding shift. I was wondering if you had any thoughts on that, or any background on
that's a very good point to bring up. Very good point. And we have quantified the percentages across different studies of individuals who have second and third jobs, and it's quite high. I think pretty consistently, on average, probably 30 to 45% of the individuals who we investigate in terms of our different studies will report working second and third jobs. In some locations, it has been reported as much as 80% of personnel work more than one job, and that is a challenge. It obviously is a challenge in terms of them getting the adequate rest and sleep that they need to feel less fatigued, because it's going to be a fatiguing job. You're never going to eliminate fatigue. You're just going to manage it. Is essentially what fatigue guidelines are designed to help you do. It is impossible to completely eliminate fatigue. The working of second and third jobs obviously is a factor. We don't, in terms of when I say we, I mean the research community, really don't know how big of a problem this is, other than what we've collected in terms of our recent research. And we don't know specifically how rested individuals are going into their main job, and whichever one they consider their main job. And we do need to investigate that further. The only thing I can say in terms of that issue, we do recognize it as a problem. We don't have yet a real good, clear picture of how big of a problem it is, other than some of these percentages that we have of self-report working second and third jobs. And in terms of what to do about it, that is probably the million-dollar question in terms of what to do about it. I don't think there's a single answer or a solid set of answers yet for how best to deal with that, but we do recognize it is definitely a challenge.
Okay, and also, and since we're safety professionals and talking the issue too, even with the offering the ability to nap on a job, then you have the possibility that employees are taking other jobs and saying it's okay because then when I go to this job, I'm allowed to sleep on it. So they're expecting or hoping to be able to catch up on their sleep, during the emergency medical services shift. So it's just a very compounded problem, as you said. Are there any other questions for Dr. Patterson? Okay. Well, thank you again, Dr. Patterson, for a very informative presentation, and I'm sure some of the members will be reaching out to you in the future with more questions as they digest this information and issues crop up that may be related.
So thank you for the opportunity, and please contact me if you have any questions.
Okay, thank you, Daniel.
And at this time, then, I'll have Christy Mays will present an update from the National Safety Council.
Okay. Hi, everyone, and thank you for joining this event. So in order to view supplemental documents and the webinar recording, please visit the Government and Public Sector Division's webpage, which is nsc.org/govdiv. And if you're not a member of this division yet, but you would like to be, because division membership is a membership benefit for all employees of an NSC member company, you can visit nsc.org/divisions for a free membership application, and that's online. And now I'm going to move into talking about the Congress meeting, and the Government Public Sector Division meeting is going to be on Tuesday, September 10th from 1 p.m. to 4 p.m. and registration for the division meetings is open. So if you're interested in attending this meeting, the meetings are free to attend, so please feel free to sign up. And there is going to be an all divisions reception on Sunday, September 8th. And that's going to be held at the Marriott Marquis, which is the hotel that's connected to the convention center. And the cost to attend that event is $25. And there will be a revamped NSC Resource Center on the expo floor of the, Congress. And apparently it's going to be like rearranged, as in it's not going to look like it has in the past. So it's going to be arranged like on or by subject matter, because NSC is your resource for all, subjects pertaining to safety. So I invite you to stop by the Resource Center and check it out, because I haven't seen it either, but it sounds like it's going to be really good and interesting. And that is my NSC update for today.
Okay. Thank you, Christy. Let's see. Next, we have division leadership update. And David Daniels, our division chair, our outgoing division chair, is unable to be on the call today. Our incoming division chair is Mark Hoare, and he is unable to be in the call today. So right now, I guess the main thing that I would like to say as incoming vice chair is to remind everyone that we have a public eye on safety library, online library. We are always looking for articles for this, for all of us to share our input, our expertise, our areas of specialty, and we highly, highly encourage you to submit an article. It's extremely easy. You just email me with your article, approximately 500 words, which is 1 to 2 pages. And it doesn't have to be a scientific research, just your background on something and how you've solved this problem, or your thoughts about your perspective on a particular safety topic. Remember that one of the reasons, or one of the big reasons for our division, is to form a group of other safety and health professionals in the public sector that we can kind of draw from each other, ideas on how to handle issues. Very often there aren't regulations that pertain to certain safety issues that we come across. Certainly OSHA doesn't even apply to public sector in most cases. So just having information on how other public sector professionals, safety and health professionals, are dealing with issues helps us become a little stronger, helps us make our decision-making a little more well-founded. So, again, I encourage you to please submit an article. You can email me or call me, whatever's easier for you, and we can discuss the topic if you like, or just go ahead and write it up and send it to me, and we'll review it and hopefully get it posted on our website. Other than that, I wanted to encourage everyone to be at the Congress meeting, which we'll talk about shortly, the agenda for that. And when we meet in Congress in San Diego, something that we started a few years ago is, in addition to our meeting in the afternoon, which we'll talk about, we also get a dinner, impromptu, everyone pays their own bill, dinner on Tuesday night, the night after the evening of our division meeting at a local restaurant. It's a lot of fun. We just sit around and talk and get to know each other a little better. So this year it's going to be on Tuesday after our division meeting at Joe's Crab Shack in San Diego at 6 p.m. And please, if you're going to Congress, please make room to meet us there that evening too for the impromptu dinner. Okay, and moving along. The Congress, the National Safety Council Congress and Expo for 2019, as most of you know, is going to be in San Diego. It's going to be starting on Saturday, from Saturday, September 6th, and going all the way till that Thursday. Our division meeting for the Government and Public Sector Division is going to be on Tuesday, September 10th, from 1 to 4. It's at the Marriott Marquis in San Diego, Coronado, South Tower, Level 4. And this is a really important opportunity. If you're at Congress, please make the time on Tuesday afternoon to join us for that meeting. It's probably the only time in the year, other than that, our spring meeting, that most of us can actually put names to faces. And we're so much more effective when we can meet briefly and discuss issues and come up with possible resolutions or action plans among us. So I really want to encourage everyone to set aside Tuesday afternoon. If you're going to the Congress, set aside Tuesday afternoon from 1 to 4 for our Government and Public Sector Division meeting. The agenda of the meeting, and then remember that we have the division dinner at 6 p.m. just following that at Joe's Crab Shack in San Diego. And the agenda of I'll briefly let you know what we're going to be covering at our division meeting in San Diego. We're going to recognize Michael Ballard as a recipient of the DSSA recipient award. And then we're going to talk about government affairs, have a government affairs update from our Senior Director for Government Affairs from the National Safety Council. We're going to have Mark Hoare, our incoming division chair, discuss how to build a corporate safety program. We're going to have a program workshop, building a safety program from scratch, and that's going to be chaired by David Daniels. And then we're going to discuss division initiatives for the next year. And this is where your input is extremely important. At these meetings, we discuss new ideas, and very often they're implemented. They're very quickly implemented. And then we're going to have the passing of the gavel, the division leadership change. So I encourage you, please, to be there on Tuesday. Okay, with that said, is there anyone that has any ideas, any suggestions, any comments that they would like to make? One thing that I would like you all to consider is, as far as the webinars, these webinars are extremely informative, and in the future, we're going to be asking you if you'd like to keep the webinars at once a month, or if you'd like to go on another schedule of possibly every other month having a meeting and having a webinar. I know a lot of us are it's difficult to schedule the time to listen to all the webinars, no matter how informative they are. So that's something we'll be asking you soon, to let us know if you'd like to go on a bi-monthly schedule for our meetings, or if you'd rather keep them once a month, and we're open to both ideas. And are there any other comments, ideas, suggestions from anyone in the audience? Okay. With that said, then we're going to adjourn the meeting Thank you all for being here, and the next meeting is going to be August 12th, Monday. Is it August 12th?
Yes, Monday, August 12th.
At 10 a.m.
At 10 a.m.
Central, 11 a.m. Eastern Standard Time. Thank you all for being here, and have a safe July.
Okay, thank you, everyone.